Hello, my name is Della, and today I'm going to teach you how to set up a BiPAP. So first, we have to verify the physician's orders, and then the next step is we're going to check the patient's chart. At this moment, we are using Miss Anna Ortiz as our patient, so we need to check her chart. So we are going to look for vital signs, ABG test done, chest x-rays, if the patient has history of BiPAP, and then if the patient has a history of being intubated, and if the patient is a high risk aspiration. So some indications for this procedure are CHF, ALI, ARDS, and pneumonia. And then some complications are if the patient can protect her own airway, or if the patient is high aspiration risk. So after that, we are going to gather our equipment and the necessary accessories. So we need first our BiPAP machine, or the NIPPV, or non-invasive positive pressure ventilator. And we need to have the corrugated tube or the circuit, and we need to have the HME in here. And we also need this sizing chart, and then I'm also going to gather all three small, medium, and large masks. So I have all of them in the room, that way I don't have to go out and get them if I need for the right sizing for the patient. And then I also need this chart for charting later on. So after that, I would also want at least one oxygen tank, just in case I have or we have to transport the patient. So after that, I'm going to wash my hands and go inside the patient's room. So we're going to knock. Good morning, Miss Ortiz. My name is Delo, and I am from the respiratory department, and I am here to give you your BiPAP. So can I have you state your name and date of birth for me, please?
Anna Ortiz, 3492.
Thank you. Let me just verify that. Okay, great. So this procedure is just basically going to help you decrease the work of breathing and help you with your oxygenation. And then some risk for this procedure, you could potentially get a barotrauma or a pneumothorax. So pneumothorax is basically an air escaping out of your lungs, and a barotrauma is just basically making a trauma in your lungs. So I just want to let you know and make sure that you're aware of that, okay? But I am going to try my very best to manipulate and do the settings for this device. That way we don't create those possible risks, okay? So at this point, I'm just going to plug this in. Make sure I plug this into the red socket right there, right here. This will give us electricity when the power runs off. So there's a backup generator right there. And then I'm also going to attach this to the oxygen source, which is located on the wall. So even though we have an oxygen tank that's attached on the BiPAP itself, let's just say that there's a tank in there, we don't want to use it because that's only for emergent, just for moving patients around, okay? So now I'm going to actually glove up. There we go. And then after gloving up, I'm going to take Miss Ortiz's vital signs, make sure I have her heart rate, her saturation, her breath sounds, and her blood pressure. Would also want her temperature just in case there's no um, infection or anything like that happening. So just gonna turn on the machine and make sure that everything is connected, the circuit and everything. So right now we're going to mask port. We're going to do a test. So just go to mask port, and then we need to check the mask and see what kind of number we have. So right here it says on the mask 1, and it's a Respironics mask 2, which is the same as the BiPAP machine. So we are going to choose 1, accept. And then for exhalation port, there's different kinds of exhalation ports, and our BiPAP itself has an exhalation port, and then our mask itself has an exhalation port as well, just to make sure that the patient could exhale or expire all the CO2 and not be retained in there for the patient to breathe. So we are going to choose the right exhalation port. At this point, we are not using a whisper swivel, nor a DEP or disposable exhalation port, or PEV or Respironics plateau exhalation valve. So we are going to choose other. The BiPAP is not gonna allow us to use none because the mask itself has an exhalation port. So we are gonna choose others and just wait till you see the start test and occlude the circuit and begin the test. So this is just gonna test if there's any leak or any holes on the circuit. So I'm just gonna repeat the test. So for you to hear, you would hear here that it's gonna blow different kinds of different levels of air, just to make sure that there's no any leaks in it. Okay, so now it passed the test. I could start my ventilation. So at this point, I'm just gonna put it on standby so it doesn't alarm. So that's just gonna put us into a standby mode. So now I'm going to modes, go to batch SD or batch spontaneous time, and we are going to manipulate or do our settings in here. So we'll start with IPAP. IPAP is inspiratory positive airway pressure, and this is more of manipulating your CO2. So if you have low CO2 or is having a hard time breathing CO2, this is good. So our starting point is 10. And then EPAP is expiratory positive airway pressure. This is more on O2. So if you have an O2 problem, you manipulate this, not the IPAP. So this is also good for holding air inside your alveoli, which we call FRC, or functional residual capacity. And the good starting point in here is 5. So we'll hit accept. And as you can see, it turns yellow. When it turns yellow, it means that we had changes done in there. So the normal respiratory rate is 12. So we're gonna leave the respiratory rate at 12. And then oxygenation. If the patient doesn't have any oxygenation or any oxygenation device, and we don't know the flow or the rate, we automatically put them on 100% and try to wind them down. And then, so right now, let's just say that Miss Ortiz is on a nasal cannula under 3 liters per minute. So we're going to do the math. So we'll multiply 3 with 4, add 21, and it'll give us 33. So that's gonna be the FiO2 of the patient. And then I time is basically just the inspiratory time, or how long is the inspiration going to be per second. And then rise is just gonna be the jump between EPAP to IPAP. So if you put the rise time to 1, it'll give you a blast of air, which is kind of like hard to most of the patients because it's giving you a blast. So 3 is usually a good. So it's gonna be a little bit more gradual of a movement of air. And then ramp time is just for patient comfort as well. So this is good for patients that's about to go to bed and they can tolerate their the settings that they need to have. So we give them the ramp time. So it gradually escalates to the settings that we put them in. So right now we'll put them in 10 and we'll activate batch change. So once it's activated and it's still on standby, I'm going to grab my mask and I'm going to fit the patient. Okay, so prior to doing that, almost forgot, but managed to. So I'm going to explain to the patient what this is for. So Miss Ortiz, this is I'm just going to size you for the mask. So this is like a sizing chart to make sure that we have the right fit for you. Okay. So at this point, we're going to start at small because she's a woman. So we start at small because they have smaller figure. So make sure that it's under the lip and on the top of the bridge of the nose. So we could tell that she's a small. Thank you. So we're going to grab our small one. So, and we're going to explain what this is. So, Ms. Ortiz, this is just a mask. This will create a tight seal on your face to make sure that you're going to get all of the oxygenation that you require, okay? So I'm just gonna have you touch it, kind of play with it, okay? So at this point, we're going to put this on the patient to have the sizing. So I'm just gonna place this right here under the lip and on the top of the bridge of the nose. I'm just gonna place this in here. Sure, we there we go. Kind of let this part go first so that good. Place it in here. Just gonna lock this in here. There we go. And we need to make sure that we adjust it all together, both at the same time. And we need to make sure that we don't leave the patient with just this and without oxygenation because she could rebreathe her CO2. So we start adjusting the very top. Make sure it's snugged, not too tight. Is that good or? Okay, so the patient agrees that it's a good fit. Then we're going to adjust the bottom.
Okay.
Too tight? Okay. How about that? A little too tight? What about that? Good? Okay. So now the patient says that this is a good fit. So now we could attach that to the patient. Actually, prior to doing that, I need to make sure that the patient knows how to take the mask off so that if she needs to, if she coughs up anything and it needs to expel it out, or she needs to vomit or anything, she knows how to do so she wouldn't aspirate. So you just pop this two off the sides, pop it up, there you go, and that'll take care of the taking out of the mask. Okay, so now we'll connect the patient into the machine. There we go. So right now the patient's rate is at 20, 19, has a tidal volume of 688. So now we could go into our alarm settings and set the alarms for the patient. Okay. No patient trigger. Is there any leak? Do you feel any air coming out? Okay, so we need to make sure that there's no leak coming out of the mask. Make sure that there's a tight seal, but not too tight to have the lesions and create necrosis. Okay, so right now she is breathing 22 on the respiratory rate. So I'm going to up this into 30 because she's more than the normal, and I'm not gonna change the low respiratory rate, because if the patient hits 10, this will alarm. Okay, so this is just alarming because there's no oxygen available, even though we hooked it into the whole wall. There's no actual oxygenation, oxygen coming out in there. So that's why the alarm is coming off. Okay, so now she has a tidal volume of 599. It's playing around 500 to 600. So our normal tidal volume is 500. So it's usually the volume that the patient is breathing, or the tidal volume that she's having right now. There's should be a 300 gap between. So I'm going to place this in, so that's 600, 700. We're going to place it in 900. There. And then low tidal volume of 500, just the minimum. So I'm not gonna change that. And then high inspiratory pressure, or HIP, is the same as the IPAP. So I'm going to place HIP on just 20, so that if the patient breathes more than 20 centimeters of water, it'll alarm. Make sure that I could increase the IPAP in that case. And then next up we have the lip, or low inspiratory pressure, and this also has to do with the IPAP. So it's just basically going to alarm if the patient breathes lower than 10 centimeters of water. So I'm going to put that on 5, because I don't want her to breathe lower than that, or actually maybe 8 is better. 8 or 7, somewhere there is good. So I'm just gonna leave it in 7. And then minute ventilation, the normal is 5, and so we could decrease it or increase it. I'm just gonna leave it at 4 liters per minute for the minute ventilation, so that if the patient breathes lower than for her minute ventilation, if it's lower than 4, it'll alarm. So right now she's on 8.3 liters per minute. I'm just gonna check that. And then low inspiratory pressure time, this is just going to kind of warn us once the LIP goes down at 7 to 7. So after 5 seconds, it'll alarm. So 5 seconds is always good. So it'll alarm quick. So now that we have set our alarms, everything looks good. Her leak is good too. Any kind of leak that's lesser than 30 is always good. She has a PIP of 9, and then yeah, everything is good. She has a low tidal volume right now. It's the alarms will determine, will tell us, or will let us know what's happening. So we need to listen to the alarms, and then always look at the alarms to make sure that we know what's going on to the patient, because we don't want them to go in a respiratory failure or anything like that. And then we have a graph in here that just shows the progress of the BiPAP. So that's the EPAP, and then the jump going to IPAP, and then go back to EPAP. So that's just showing us we could play with it too. And then, so now that it's all set, we could actually end ramp, because we don't need it at this point, because the patient could tolerate the oxygenation. So when we hit to this point, I'm just gonna lock the screen so no one could touch it, and then we could always just press the check mark to allow us to touch it again. So that's it for setting up the BiPAP. So I am going to, that's just for the oxygen available. So I'm just gonna silence the alarm, and then Once I'm done with in here, I'm going to um, note all of the settings that I did. After that, I'm going to talk to the patient and then just let them know what's happening. So if you feel any discomfort, chest pain, shortness of breath, or any nausea, just let me know. Your call button is right here for the nurse, and the nurse will let us know what's happening. Okay? So I'm just gonna put this on screen lock, and then after that, I'm going to do another round of vital signs for trending. Make sure that I listen to her breath sounds because that's really important at this point. And then after that, I'm going to ask the patient do you have any questions? Okay, so right now the patient doesn't have any questions. And one more thing, usually we have a little kind of stick hanging at the side of the ventilator. So that's just to hang this so that the wirings are not all over the place. So after that, I'm just gonna take my gloves off, throw this. I'm just gonna put this in my pocket right now. Then wash my hands, and then after that, I'm going to record the stuff that I did, and then the interaction with the patient, and then the vital signs and all. And then I'm also going to order an ABG 30 minutes after the actual onset of the device to the patient. And then I'm going to actually order a chest x-ray to see if there's any barotrauma or any pneumothorax building up, so we could take action. And then after that, I'm going to record everything again, make sure that I have everything set up, and then I'm going to call the physician or the nurse practitioner to let them know what's happening, and then let them know about the orders and the recommendations that I have. Then after that, that's it. So some indications for this one, as I said earlier, this is good for patients that has CHF, pneumonia, pleural effusion, ALI, ARDS, and it could also be good or potentially be a benefit for asthma patients, but that's kind of like controversial. And then for contraindications, so if the patient is a high risk for aspiration, we don't want to put that on the patient. And then if the patient has any apnea problems, for them to, and then some implications for this. Actually, for contraindications as well, barotrauma, as I said earlier, and then pneumothorax, because those are like one of the big ones. And then this is good, like advantage of the NIPPV versus a mechanical vent. This could we can manipulate this, their IPAP and EPAP, and then this could also go onto a CPAP. And this is easily, we could easily wean the patient, such as COPDers. It's much easier to wean them using this one rather than intubation. So that's like a really good advantage of this one versus the mechanical ventilator. And then for the trigger, so we, as you guys saw earlier, when we put the patient or the ventilator on standby, when the patient triggered the breath, the inspiration, the mechanical, the BiPAP triggered to and give breath to the patient. And then for the fitting of the mask, we need to make sure that it's not too tight and not too loose, because if it's way too tight, there's gonna be lesions and necrosis. So that's all. Thank you.